If you were to ask a physician, what would be the most bothersome symptom or biggest concern for patients, they would say bleeding, but it's really fatigue, it's depression, it's anxiety, it's those health-related quality of life issues that have such a huge impact on a person's daily life.
Well, I'm Eric Racine. I'm the head of public affairs and patient advocacy at Sanofi. I'm here today with Kruse, who is the CEO of the Platelet Disorder Support Association, PDSA. Welcome, Caroline.
Oh, thank you. It's so nice to join you today.
I'm also here today with Carrie Brown, who is the head of U.S. communication for Sanofi. Welcome.
Thank you, Eric. It's good to be here.
Great to have both of you here. So let's start with you, Caroline. PDSA. Tell us a little bit about the organization and the mission.
Well, for 27 years, PDSA has been enhancing the lives of patients with immune thrombocytopenia, or ITP, and other platelet disorders through education, advocacy, research, and support. We are truly the premier patient advocacy organization for our patient community and for healthcare providers, really not just in North America, but really around the world. We oversee 33 ITP patient associations in 30 countries. We have 2 publications that reach around 30,000 patients, healthcare providers. We have an annual patient conference. We have 12 educational booklets, which have been translated into 15 languages for a total of 35 translated booklets. We have programs for children, for adults, for teenagers. And we have a network of 67 local ITP support groups in the US and Canada. And those are just some of the programs that we offer.
This is impressive.
Thank you.
How many years has PDSA existed?
We're in our 27th year.
Well, congratulations, 27 years.
Thank you.
Yeah. Welcome, Carrie. So tell us a little bit about your role at Sanofi.
Sure. So I'm head of communications for the US, which means that I am responsible with my team for product communications, across our 3 business units, employee engagement communications, social media, brand and reputation for Sanofi in the US, so it's kind of all-encompassing. We tell a lot of stories, and we make a lot of connections across the organization.
A very important role at Sanofi, and thank you so much for being part of that.
Thank you.
So let's go back to you, Caroline. If you had to think about priorities for the patient with ITP when you look into the next couple of years, could you tell us a little bit about what you think are the priorities for your organization?
Well, even though we've been around for 27 years, and I think we've done a wonderful job of educating and supporting and advocating for ITP patients and those with other rare platelet disorders, there are still a lot of unmet needs within our community. First and foremost, getting a proper diagnosis, and then having patients find an expert in their disease, because we find that patients cycle on and off of treatments. And I mean, we are fortunate that there are treatments available for patients. And so the future looks very bright, though, for our patient community, because there are many more treatments in the pipeline with different mechanisms of action.
This is important, more option for patients. Mm-hmm. So Carrie, for you as the head of communication in the US for Sanofi, what would be your priorities for patients in the years to come?
I'm in a unique position to be able to tell stories. And I think really sharing those patient perspectives and sharing their stories is incredibly important. I think it makes a lot of different connections, it drives awareness, it drives understanding. And it really does make the connecting for the patients and the community imperative. So I see that as a huge priority for us. Within ITP, but even beyond that.
Yes, very important. So now if you take a step back and you think about what would be one thing that you think needs to be done, urgent thing to be done for ITP patient, what would they be?
To continue to include the patient voice, to just kind of take off from what Carrie just said. There are many physicians that still don't understand the impact that a rare disease like ITP has on a patient's quality of life. If you were to ask a physician, what would be the most bothersome symptom or biggest concern for patients, they would say bleeding, but it's really fatigue, it's depression, it's anxiety, it's those health-related quality of life issues that have such a huge impact on a person's daily life. And asking patients to share their stories is very empowering, and so we need to continue to do that and to include the patient perspective in clinical trials and make sure that they're included in clinical trial outcomes.
Seems to make a lot of sense. Carrie, what do you think?
Yeah, I agree. I agree 100% with what Caroline said. I think that there's often times that we talk about bringing that patient perspective, but I think it's incredibly important that they actually hear it from the patient. I think beyond that is access, right? And getting patients on the right treatment and helping them to stay on it, for appropriate patients. And I think we have a responsibility to ensure that we're getting patients to the treatment that they need.
Mm-hmm.
You seem to both agree. So next question for you. What gives you hope in terms of innovation for ITP in the years ahead? What gives you hope personally?
I think that there are so many treatments that are in development, and I think short of a cure, if we could, it's such a personalized disease, and if we could understand what the underlying pathophysiology or mechanism is of each person's disease, then we can have treatments that are tailored to that patient.
I think all of the innovation and the research that's being done for ITP is going to change the lives for people. Right, I have a very good friend who has a child with ITP, and just knowing that her life will be different, right, because of all the innovation. Like, we work in such an amazing industry that brings and drives that hope and solutions, and I look forward to seeing where the space takes us.
These are great work. Thank you so much for everything that you do in ITP patient, for the PDSA organization. Amazing organization. And Carrie, thank you so much for the hard work at Sanofi.
Thank you.
Thank you.